Hey folks, welcome back to the Transplant Helper again today. My name is Jim Merle and I'm so excited. Here we are once again. It is time for one of my brand new programs, a brand new series I'm putting together here called My Story, My Words. And I'm thrilled today to have the guest on that we have. Barbara Allen is a two-time heart transplant recipient. First heart lasted roughly about 14 years, and so she did pretty well there. And she's in it again here for about 7+ months. So we're going to be talking with her in just a little bit. And I think she's going to give a really, really different perspective about this than probably what anybody else could, unless they, like her, they're in the rare club, who have had 2 or more heart transplants. Anyway, with that being said, Barbara, I'm so thrilled that you're with us today. So if you would like, just start out by telling me a little bit about yourself, about your family. Whatever you'd like to throw in there would be absolutely great.
Okay, so yes, I'm a 2-time heart transplant recipient due to the grace of donors. I am a 39-year-old mom of one daughter who's 16 years old, and when I'm not a mom, I'm a teacher. I'm a kindergarten teacher, and this year I get to do it virtually, which I'm very thankful for, and I am engaged to get married, but we all know because of COVID, that might be a little while before it happens. And I have 2 puppy dogs, and we live here in Dallas.
Where did your transplant take place then?
We have a hospital called Medical City Heart Hospital, and it just opened up a little over a year ago.
Oh.
So just a little over a year ago, it opened up.
Oh, jumping in there
so
with brand new ideas.
Yeah, they had a bigger hospital called Medical City Dallas, and that used to do the heart transplants before, and so they had such a big program of heart transplants and other heart-related issues. So they opened up a separate hospital just for this.
Oh, that's excellent. Okay, so let me ask you this. How were you first introduced to transplant? I mean by that, what actually caused you to need a transplant? And let's say, for example, the first transplant.
Okay, so the first transplant, the reason was I had postpartum heart failure. And that is after I had my daughter, about 6 weeks after I had her, I was already developing the symptoms of heart failure, which was like the coughing, the shortness of breath, hard to walk across the room. But being such a young age at 23, they were misdiagnosing me with, a sinus infection, pneumonia, just everything but heart failure. And so eventually I was in the hospital again, and I was eating a popsicle, and the popsicle hit my aorta, and things went off, saying something was probably not right with the heart. So they went ahead and did an echo, and then that's where they found I had 10% usage ejection fraction of my heart. So at that point, they went ahead and decided I need a transplant. But of course, at that point, my body was too in just not good a shape to get one. So I did get the Lvad.
Okay. Well, thank God for popsicles then. And
yeah, exactly.
How long were you on the Lvad?
I had the DeBakey Lvad for 9 months.
Okay.
9 full months. And then I got my first heart transplant 9 months later. So I was able to recover. My body was in great shape by the time I needed that first transplant.
Right. And that makes a difference. I mean, as well as anybody, that makes a huge difference when you can, you hate to wait that extra time, but when you can actually recover and be ready for transplant, that's a huge thing.
Yeah, I know a lot of people are always cautious on it, worried about it, but honestly, it's a really great advance in science to help your body get where it needs to be to recover from a heart transplant or any type of transplant. Yeah.
Right. I have a good friend of mine just down the road here. He had to do an Lvad. He, didn't want to, but it's the way it worked out. He had to do an Lvad prior to his transplant, and I can remember a conversation that I had with him probably 6 weeks after. He was recovering pretty well, and he said, "Jim, I don't know if I want a transplant. I feel so much better on this than I did before."
It feels so good.
Yeah.
Yeah, it was a great bridge to transplant. I was able just to recover from that heart transplant so quickly.
Right.
So I had the first one, and I was out of the hospital within a week. And I had that heart for 14 years and 11 months, and was doing great. I graduated grad school, watched my daughter grow up a lot. Right. All her first and got to see a lot of her first things. So, and I accomplished it a lot. I see a lot of weddings and all that. So it was really good for the first 14 years. About 3 years ago, I developed some blockages in the new heart. And so they call that CAV. And, I had to have a stent put in, no big deal. But I just started, feeling tired a lot was mainly my symptom. I will tell you, this was strange. I was almost self-diagnosing myself when I needed the stent. I did feel pain in my chest and my back, and they a lot of times tell us as heart transplant patients, we won't feel that ever. We won't feel chest pain, and we won't feel back pain. But I was feeling those things, and I actually was feeling some pain in my wrist. And every time I would, clock it and stuff. So I went to the doctor. I was like, I've Googled this. I have a blockage. And he was like, well, I was like, no, I have a, so he did different tests, and I said, I need a heart cath. And sure enough, we did a heart cath, 95% blockage. They put the stent in, and I was good to go. So that was 3 years ago. And slowly over those 3 years, unfortunately, I've just been very tired. And, the weight gain started coming back on. And in January this year of 2020, it was really bad. Like my right leg was really swollen. I unfortunately was misdiagnosed with lymphedema. We weren't sure. And it was not getting better. So they went ahead and did another heart cath March of 2020. So recently, and again, my ejection fraction on this heart had gone down. And they said that I need to go ahead and go with a second heart transplant. So in March, I was put on the list again for a second time. I don't think I was quite as nervous, honestly, because I heard I'd gone through all of it.
I was about to ask.
Yeah, I mean, I think that's a lot of, whenever I see on our group, that's a concern. And honestly, if you can make it once, you can do it again. So that is just something I want everyone to feel reassured. Like this go round, so I had been put on the list in March, and April, 34 days later, I got a heart transplant in the middle of COVID. No one was at the hospital. It was just critical transplants was all they were doing at our hospital. That was it. No other heart procedures were being done in April. So I got a call, and the next day I was done. And so I stayed in the hospital 8 days. No issues on this recovery whatsoever.
A champ for the second time on that. Then that's a short hospital stay for both of those. And I remember I remember this transplant. I don't remember 14 years ago, obviously, but I remember this one because I had been asked a question on the program, something to the effect of, is it even possible to get a transplant during COVID? And a lot of people were panicked because the rumor was you wouldn't. And I can remember answering the question, and you were one of the people I had in mind when I was able to say no. Actually, at the time, I think I said I knew 7 people who had had a heart transplant in the last week. So it was happening. It was just a lot harder situation as far as having to be alone and, that sort of thing. But it was happening.
So that was exactly April 17th. I received my heart. The whole thing was no family. I did it completely alone. But I felt okay with it because I've known my doctors forever. They've known me, the nurses. So you felt like that's part of your family. And we all know that as transplant. Our support team at the hospital is our second family. So I said, nothing's going to happen to me. They're going to totally take care of me. And they did. And I got the best care because I was the only one. And so, it was great. I mean, and I do believe my doctor believes I got this heart very quickly because of COVID, because at the time they were not flying organs out of DFW from my understanding. And so this was a local heart.
Right.
So I got it pretty quickly because I was a 4. I was a 4. So I was planning on waiting at least a year plus on this one. Yeah.
Yeah. Well, I didn't know about that advantage, but there's definitely an advantage there that they're not. The hearts are having to stay local, at least were.
They were at that
helpful
point. Yes, exactly. So I recovered quickly. I've had no issues. The first time I did have what y'all talk about, the CMV with the first heart, this heart, I have not had CMV.
Oh,
but
good.
I knew what to expect. Yes. So I knew what to expect, but I have not had it. And the only thing I say on this heart, if you ask if something hard, is the steroids. Again, that's just part of it.
Oh, that never changes, does it?
It doesn't change. So, if you get through those, hopefully you'll get taken off of them. I'm almost down to 2.5 is what I'm at. So, again, we'll just go through the process of getting off of them and then hopefully just staying healthy and, getting your flu shot, just taking those precautions, washing your hands, masking yourself.
Yeah. And I'm sure that routine that came about from the first until now, as well as all the experience, the knowledge, the training, everything has made this smoother. I don't know if anything could be said to be easier, but smoother because
exactly.
you do know what to expect.
I was a great candidate for one because I took care of the last part. They said, it's hard to even be a candidate for a first one. So it's let alone the second one. They have to know you. And so they were like, we know you can do it. So I did get to do my cardiac rehab, because at the hospital, there was no one there going, but they had it open for heart transplants only. So it was only like 2 of us in there.
Right.
And so I did my rehab, and rehab is awesome. I love that part of it. So.
Yes, I always recommend the cardiac rehab. I know people see the dreadful side, they're going to push you, they're going to this, but to have those experts, for lack of better terms, that are overseeing your care, they've got a safety net in place there for you with the monitors and everything else that's going on, where you can actually get back moving. And it's something that you just, honestly, very few will do on their own. If they try to do I'll just do it by myself at home. Probably not. Not that well.
Yeah. They're experts, like you said, and they can help you, and you feel so much better at the end of I did it for 3 months, and it was so good. So I was ready to go. I was ready to work at 4 months after my transplant because of it. I felt like I was just like, I'm ready to go back. Of course, this year I'm not going back into the classroom with precautions to COVID. So HR at my school district is allowing me to work from home. So that's very nice of them.
Well, that's one of the very fortunate things that I'm thankful. Not everyone's received that kind of blessing, but a lot of people are getting to work from home. So they're getting that, for you, for example, that's a huge buffer, between, hey, you just had a heart transplant back in April. So you got that buffer area before you may end up back in the classroom. So
exactly.
I'm thrilled
you
you're
just
able to do
that.
it.
I have this year to recover fully and protect my immune system.
Yeah. Well, from the experience of being a school teacher, though, even a kindergarten teacher at that you're putting yourself, when you're in the classroom, you're in a pretty precarious situation, but you've already learned to handle that again. So another advantage that you may have in the future as far as going back in the classroom. Well, you answered a couple of my questions to an extent already. I was going to ask you about the wait time. Very short wait here on the second one, and that's such a blessing, because that's one of the things that I say all the time. The wait can be the hardest part, and probably is in most cases, and especially on that second one, because you just... I don't know that this is true, but I'm always concerned if I have to face a second one, but that I won't necessarily be that priority again,
Exactly.
Because a lot of people have an attitude about that.
Yeah, but I would say I think that's a fear of all of transplant patients. What I have to do again, I never thought that was going to happen. I felt so good those 15, pretty much really good up until the last 3 months of it. And I was like, and when they said it, I kind of was like, well, okay, let's do it again. It was no big deal, and just kind of rolled with the punches, because I know that they knew me, and they're one of the, they're the best doctors at what they do. And so when they felt that they could help me, and I was, had blood thinner, so I had some risk involved, and I was older, but they knew. So they really, if you're a candidate and you qualify and you need it, I would definitely take another one. I would take a third one. I know there's a person out there that had a third one. So.
Well, I have said for a while, said at least in the beginning, that I wouldn't go through it again. And that wasn't as much for me a matter of it was so hard and terrible and, painful. And it wasn't that. It was just at that time I thought to myself, you know what, I got a shot at this. If it works, it works, and I'll live out and I'll be fine. And to an extent, I'm still in that place. But after knowing people who've gone through it before and seeing that, hey, you can get another, I'll use your number, 14 years or more. Who knows now? Technology has changed, medications have changed. Who knows what you'll get from this this round, and I've kind of gotten a different perspective about it. And the main thing is my children. I keep looking at my children and thinking, we've adopted 3. So I now have 5 children, but 3 of them are 6, 5, and 4 years old. And I haven't seen enough of their life yet. So if I had to face it tomorrow, I would probably jump in it with both feet.
You will. And, you've already gone through it once, so you know exactly. That's the thing. I knew the medicine. It's like all, they teach us so much.
Mm-hmm.
And they're like, this is going to be the easy teaching we have to do of all of them. So it was just, I did change some medicines, of course, but it's just like ride that back again. So.
Right. Well, tell me about your recovery. And you may have already mentioned this just a little bit, but specifically about your recovery since April.
The cardiac and rehab was really good. This one, I did have one little issue with where where the bypass machine went in. Mm-hmm. My leg just didn't want to close up, so they've had to put that wound back on, and honestly carried it around like a purse. And within a week and a half, I was, good to go. So recovery on this one, it has been so much easier. I just really follow the doctor and physical therapist advice on everything. Don't use your arms, all that. Just really, in your nutrition, take that into account with post-transplant. I have not gotten sick once. So in almost 8 months, I haven't caught anything or anything. So just really follow their advice.
Well, that's, you have been on some form of, even though some change, some form of immunosuppressants for so long till not only is there no learning curve there, but also I think if your body was going to, and this has nothing to do with rejection, that's a new organ, new set of rules.
Exactly.
But, as far as catching colds and stuff, your body has, at least I know mine has, it's gotten to a place now where I think I've met a happy medium between I'm not catching everything everybody's getting. Actually, I think I catch less than, my family has been wiped 2 or 3 times this year by various things. Thankfully, COVID hadn't hit our house, but, the stomach viruses, that sort of thing. And I'm the only guy who didn't get it. And, you think,
yes.
But I think we have some, maybe our immune system's learning a new way of doing things or something.
I think, your immune system learns a new way. And I think my body was already used to all the drugs. Mm-hmm. Even though, I went through the new process of them completely wiping out my immune system when I got the transplant that day. My body's used to the drugs and the side effects from the drugs. So it never really changed anything. I'm telling you, as soon as I could get up and walk around, I could. And then writing, I wanted to use my brain. Like, mm-hmm. I could not just sit there and I was like, I have to do it. And it wasn't social media I wanted to do. It was like reading or listening to something. It's really hard when on the prednisone, but I wanted to write and do stuff. And so, immune system wise, I haven't caught anything, because I think you're right. We just kind of, I don't know what it is, but our system kind of just learns. So it's like,
right.
And like I said, I teach kindergarten, and we got lots of stomach bugs in there. I never get them ever. I'm like, how do I not get these things?
Yeah.
It's like so strange. Or they'll all get pink eye, and I don't get it.
Yeah. Hey, if you miss either one of those, you're so blessed. Those are 2 of the most horrible things anybody can deal with.
Exactly. I'm like, how did they all get it? And I didn't even get it. But I just wash my hands a lot. So.
Yeah. And I know we're in the middle of all this COVID, and the mask is the big, it's the storyline every day. It's the fight among everybody. It's all that. Hand washing is where it's at. That's mm-hmm. the habit that I've been in for really before transplant. So for me, 7.5 years, for you a lot longer, but I think that's the difference between what we catch and what we don't in most cases. And the fact that we don't touch our face as much, probably. So we've learned.
Yeah. I'm so thankful, like, in a way, for COVID, for the fact that it's making people mask up right now during flu season.
Yeah.
Because that's the only thing I will catch is the flu. But I feel like I wish we had to wear a mask during this time anyways, because it's like, it really prevents a lot of people from getting sick.
Mm-hmm.
So, yeah.
I think when we come out of this, and I'm confident that it'll happen, we'll come out of this, whether it's through a vaccine or however, but I think that for some people, maybe not the majority that we would hope, but for some people, it's going to be a game changer, because a lot of people, for the first time in their lives, have had to be cautious, have had to be aware, have had to be considerate of other people, and it could change some things.
Exactly. You're exactly right. So,
well, let me ask you this then. So your recovery has gone very well this time, this go round. What are the best, and I like to balance things, so what are the best and the worst things about transplant for you?
The best thing is I feel like transplant people, or us, we see life in a different way. So I think that's the best thing. It's like you took a step back out of life and you look around and about you, like, because we can hide it so well. We can hide our chest scar and we can be normal and no one thinks anything about us. Like, they would never suspect it of you had a heart transplant. So you can watch, I guess, people's behavior, how people are kind to others, or if they're not kind. You kind of see that more often as a transplant patient, because you have another look on life, like how special and precious it is, and that you got a second chance, and how to treat others. And so you're able to really see that. So I think that's the one thing out of transplant I've taken away for pretty much my whole life, almost half of it, my grown life, is that how people are with other people. And, the doctors and the nurses, they care so much for us, that take care of us. They're passionate about their jobs. They do this for people because they want to save lives. And so I think that I'm really thankful for that. And then all the organizations that set up transplant, I've really volunteered a lot with Southwest Transplant here in Dallas, and very thankful to give back my time. And hopefully I saved somebody else's by assigning somebody else as an organ donor. And then, I guess the worst thing on transplant would be, like, it's not good. It's just the fact that if it's like a medicine, be like steroids or something, the side effects of drugs are the worst thing, I would think, for us as transplant patients. But I think we can all get through those things. I would rather have shaky tremors than shortness of breath and can't walk down the street. That's just not a fun way to live.
Right,
so
that's right. Well, I refer to it, and many do, the devil's drug, and that's what it is. Let me ask you, this is kind of side to that, but were you able to get off prednisone the first time?
I was.
Okay.
I was able to, and he wasn't sure on this go round. He was like, I'm going to be really honest with you. I don't know if I'm going to take you off the second go round because, of CAB, and they honestly don't know why. They're doing a lot of research on why we developed that. He did change some drugs like cholesterol and stuff this go round. So, but now he said recently, he was like, I'm going to go ahead and take you off of it because you're doing so well, and it is putting weight on you, and you don't want to gain a lot of weight. That's not healthy either. So, so he's going to go ahead and try to pull me off in January.
Well, that's awesome. That's awesome. I got off of it as well, and I have a lot of people who have never heard of such, and they're like, wow, how did you do that? I didn't really do anything special. My team tapers, and even when I got off, I was told, hey, you're one of the few we're taking off, but here you go. And so after little bumps in the road from the addiction I think I had to it that caused me some issues, I don't even care to ever see it again, but I'm glad to be.
I think your body is addicted to it. You're not, we're not addicted to it. It's our bodies that become addicted to it, and they can have the side effects of addiction from it.
Yeah. So, I did a program on it. It's been over a year ago now, but a lot of it comes down to the adrenal glands can be damaged from high dose long term. And it's very hard, if even possible, for that to recover. So your body, either that does recover the adrenal gland, or you kind of, like the other we mentioned, you compensate and you can get past it that way. But it's harder to come off of. People get excited. It's harder to come off of probably than they think if it's been long term. But so best and worst, you mentioned that. Let me ask you this then. This is your moment to shine. You've already been very inspiring, by the way. But what piece of advice would you give to someone who, and you can choose to do one or both, but what piece of advice would you give to someone who's either waiting or just received a transplant?
I would say on the received a transplant, give yourself time.
Mm-hmm.
Give yourself time. It's hard. The beginning is the hardest part, but as time goes on, it will get easier. I know that in the beginning, those medicines really wreck us up. They do. They wreck us up. You know, you can get really sad. You can get really happy, but give your body time, and you will get through it. It's one day at a time. And I mean, think of all the things that you're here for. So I look forward to. And if you're waiting, you know what? It's just like we were talking earlier about waiting. When you're pregnant, you know when you're going to have that baby, or when you're going to plan a wedding, you know when you're going to get married. Transplant, you don't know. It's the unknown, and it's a killer. But just wait. You know, it's not our choosing. So, and when it comes, it's the perfect time.
Absolutely. And that is the thing. As hard as the wait is, and I'll say this every time the word wait comes out, a few things. One, every day you wait is the day you had, so that's an attitude to keep. And two, you know, we are waiting on an unknown, so why not choose in your mind, try to choose the most positive outcome. And so just assume, okay, yes, I'm waiting, but what I'm waiting for is a new life. I'm waiting for a new opportunity. I'm waiting for a day when, you know, depending on what it is, for us, a heart transplant, when I can actually walk to the mailbox. You know, that's what I'm waiting on.
Exactly. Walk into the mailbox or drive into the store. Like, you know, the little things that we take for granted, getting out of bed and walking to your kitchen, we take for granted every day. And, you know, again, I started taking them for granted after the first time, because when the second time came, you know, I had to go through a lot of those things again. I'm like, oh yeah, you know, you got to be humble. You got to humble yourself down. So it happens. But those are the things, just appreciate the small things, because if you can wait, it'll be so much better.
For sure.
For everything.
Absolutely, for sure. Well, I definitely appreciate you talking to me today. I'm highly impressed, and since I saw your story, like I say, back then when you had your second, maybe before that I knew of you, but anyway, from then I've just been like, wow, okay, this can be done, and it can be done twice. You know, you can two-peat and three-peat.
Before I hadn't heard of it very often. I mean, I heard of the doctors talk about it 15 years ago. Well, you know, we have to ask some questions. Well, what if it doesn't? Well, we can do another one, and well, why? You know, just way back then, I never crossed my mind as a 23-year-old that would be the second one. But then this kind of crept up on me, and you know, I really wasn't expecting it at all, and I really wasn't. And so then when it happened, it was kind of like, okay, I can do it. You know, just kind of a mindset. I've done it once, I can do it again.
Yeah. Well, that is outstanding, and I hope you just KO, keep on keeping on, and everything that you do, and stay stronger, and just keep on going, and everybody eat your popsicles. You never know when they, hey, if there's an excuse to eat something like that, I'm going to do it. But you never know when something may come up, because I've had friends, too, that have been through exactly what you're talking about as far as the you know, after birth, what do you call it, postpartum, whatever.
Postpartum cardiomyopathy, yeah.
Yeah, that, who've been through it, and thankfully they haven't had transplant. But wow, you talking about getting blindsided. You know, that's something within itself that
because you have an
really
infant
scary.
with you. You know, I had an infant, and so I was very young, just graduated college, and that was a lot furthest thing from anyone's mind. So yeah, but you're right, it can happen, and so I just think there needs to be, you know, some information out there, about that, so that people know and just be aware.
Oh, outstanding. Again, I appreciate you so much sitting down and talk with us today, Miss Barbara, and I'm always here for you, and I know you're there for so many others too, so I definitely appreciate you sharing your story. And why don't we do something together? I end every program by saying one little phrase. You probably know what that is.
Okay.
I'll whisper it. Stay stronger, friends. And why don't we just say that together, and then I'll let you go.
Okay.
Are you ready?
Yeah.
All right. Thanks for joining us today, folks. And until next time, stay stronger, friends.
Stay stronger, friends.